Prime Minister Dr. Rukahana Rugunda has gone into self-isolation after some of his contacts tested positive for COVID-19. Rugunda is head of National Task Force for COVID-19 and has been at the forefront on fundraising and food distribution efforts to contain the pandemic. The communication advisor to the Prime Minister, Julius Muchunguzi, confirmed this development.
The Prime Minister of Uganda, Right Honorable Dr. Rukahana Rugunda, has gone into self-isolation for 14 days, effective yesterday, the 4th of June 2020, after some of his close contacts tested and came out with positive results for COVID-19. The Prime Minister himself did the COVID-19 test, and the results came out negative, but he decided to take precautionary measures of self-isolation because, number one, it is the right thing to do. Number two, it is what is recommended medically, that if a close contact tests positive for COVID, the right thing to the immediate people and immediate person around them should undertake self-quarantine, self-isolation for 14 days as they monitor themselves, as they are monitored, so that at the end of the 14 days, then other tests can be taken to confirm and determine the situation of the person.
Earlier in the day, the Ministry of Health announced 35 new COVID-19 cases, increasing Uganda's total confirmed cases to 557. 20 of the confirmed cases are alerts and contacts to previously confirmed cases from Kampala, Arua, Mayuge, Chotera, Wachiso, Dokolo and Amlata. The Prime Minister's results were among the 2,267 samples that were tested for the disease.
I, however, would like to mention that the work at the Office of the Prime Minister continues. The First Deputy Prime Minister, Right Honorable General Retired Moses Ali, is taking charge of the work at the office during these 2 weeks, during these 14 days. So work will continue. What is only different is that the Prime Minister is in self-isolation.
From the results that were released in the morning, 35 new cases were confirmed. 15 of the cases were from truck drivers, while 20 cases were from alerts and contacts to truck drivers or people who have tested positive for the disease. According to the health regulations, the Prime Minister will be in isolation for 14 days, and during these days, Health Ministry officials are supposed to check on him daily and take vitals. If he does not develop any COVID-19 related symptoms, he will be retested after the 14 days and given an isolation permit, which confirms that he has tested negative for the disease. A directive has also been made to test ministers for coronavirus. 7 frontline health workers tested positive for the coronavirus early this week, and the infected workers include 3 nurses, 2 doctors, and 2 senior level staff.